So the cells are delivered depending on the condition that we're treating. Somebody comes in and they have chronic knee pain or bone on bone or partially torn ligaments. We will do an injection into the affected joint, usually more than one location. Could be patellofemoral joint space, could be the tibial femoral space, but we deliver where the cells need to be. If it's in the back, we do the parafacets so that we're staying away from the canal, staying away from the epidural space of the spine in a very safe manner, and just flooding the area around the median nerve, which is the main source of pain signaling back to the brain, and helping the body reduce that inflammation. So the delivery is all based on what it is we're treating. Are we treating systemically? Systemically, there's different methods for delivering the cells. Originally, they did IV. IV therapy has its drawbacks because you have the first pass effect where the liver and the lungs, take out part of these cells that, are costly and expensive, and it's like, okay, there goes a third of the, my investment right down into the toilet. And that's, so other techniques have been developed. If it's a lung issue, this past year they've done a lot of research in COVID cases where they're delivering these in an aerosol nebulizer treatment to help COVID patients reduce the inflammation in the lungs to help them patients recover. So my preferred method of delivery of the cells right now, first off, is based on the patient's need and the patient's indications. We're about giving the patient the best result, and if that best result is we just need to treat the knee, then we're going to treat the knee. If the patient comes in and they have lupus and high blood pressure and diabetes, and they have back pain and they have shoulder pain and they have knee pain and they have all, the list goes on and on of all these things that they have going on, which all tie to some sort of inflammatory response, then maybe the best method is through a buccal injection where they get these cells delivered and we let the cells that know what to do go do what they need to do. And they can go work on the shoulder pain, the sciatica, the knee pain, making them sleep better, not snoring anymore. It all depends on what's the best method and giving the best solution for each individual patient. And that's the importance of coming in and having a consult with our staff, is so we can help identify what's the best method versus how much can we sell you. We want to sell you what's going to be the best and most economical and reasonable to help your condition to where you feel like a kid again. So the buccal is a technique that dentists have used for years, giving injections in the inside of the cheek to help deliver, whether it's pain medicine or antibiotics. The cheeks happen to be very highly vascular, and so this, instead of going into an IV where it passes through the liver first, it gets absorbed into the system, and the system can then, sometimes with the help of exosome cells, help transport these medicinal signaling cells to the area of the body that they're needed. We don't know where that's at always. We have patients come in and they say, I have this pain and I have that pain, and we're like, okay, and then we do a buccal injection and they come back and they say, well, this is all better and this is all better, and it's like those weren't even on their list of things that were, weren't, that they were snoring, that, that wasn't even on their list, that now they're not snoring, or their tear ducts weren't functioning and now their tear ducts are functioning again. And so the cells go to work where they need to go. And then we find out later that, we didn't even know that. But that's the whole benefit of doing the buccal injection.